Well, hello, everybody. Welcome to this special conference today. I'm happy to be joined with my colleagues, Dr. Clyde Watkins and Mike Hess from the COPD Foundation. Welcome on this beautiful fall day. I am in Houston today, doing this recording and doing this live presentation, and it's quite cool here, which I'm pleasantly surprised because I'm from Arizona, and as you know, we live on the sun in Arizona. Clyde, it's funny. I say we're going through fall in Arizona. The leaves are changing colors. Yeah, they're charcoal. You know why? Because they've been on fire. So welcome, Clyde and Mike. Grateful that you're able to join me here today. And as we walk through folks through a very important time of year with Medicare Annual Enrollment, or AEP as it's called. You know, I want to get us started. I want to just share a little bit about this partnership of Village Medical and the COPD Foundation, and why we think it's important to not only be partnered, but also present to you today some education around Medicare and chronic disease conditions. You know, Village Medical is a primary care provider focused on changing healthcare to make it easier for our patients to get well and stay well. Our doctors and advanced practice providers lead a whole care team, helping our patients get more time, more attention, and more help coordinating their healthcare. You know, we believe healthcare should be personal, accessible, and coordinated. And we do this in many ways, right? We do the virtual visits. You know, we have same-day access. We just believe that folks, they want to be seen on their terms in this day and age. It's I want it now society, and we want to accommodate that. And especially in the wake of some of the chronic disease conditions folks have, we want them to be able to access their primary care provider. And we're excited to partner with, and I have Mike Hess here with me today, partner with the COPD Foundation. They are a nonprofit organization focused on improving the lives of people with COPD and other lung diseases. The COPD Foundation's mission is to help millions of people live longer and healthier lives by advancing research, advocacy, and awareness to stop COPD and other lung diseases. With that, I want to move to some introductions. I'm Dr. David Hatfield. I am the Chief Physician Executive for Village Medical. But not too long ago, I was a primary care physician in the East Valley of Phoenix, Arizona, and where you can all imagine that we saw a lot of Medicare eligible patients and took care of many folks with lots of chronic disease conditions, including COPD. It was my pleasure to do that for 20 plus years and take care of folks and also educate them on their Medicare options. With that, I'm going to turn it over to my esteemed colleague, Dr. Clyde Watkins. Introduce yourself, Clyde. Great to see you.
Thanks, David. I appreciate it, and welcome to everyone to the video, to the webinar. My name is Dr. Clyde Watkins. I'm a general internal medicine physician. I'm the Chief Medical Officer here in Georgia, in the Atlanta area. I've been a practicing physician here in the Atlanta area for about 30 years. I joined Village Medical in 2020 after practicing in my practice Capstone Medical Group for approximately 20 years. But for those of you who may be attending watching who are from the Atlanta area, prior to that, I practiced for many years at the Grady Health System. So a wide variety of treating patients with chronic medical conditions, from providing indigent care to primary care in the community. And now really excited that we get to move to the next level and provide excellent patient care with Village Medical.
Mike, introduce yourself, please. Happy to have you.
Absolutely. Happy to be here. I really appreciate the opportunity. My name is Mike Hess. I'm a respiratory therapist and public health advocate by training. With the COPD Foundation, my role is Senior Director of Advocacy and Regulatory Affairs, where we're working to modernize how Medicare pays for some services, like oxygen therapy in particular. Prior to working at the foundation, I was one of the, fortunately, not as few, but the few respiratory therapists that actually worked in a primary care office for several years here in southwestern Michigan. So I got to see firsthand the impact of primary care on chronic disease management. And in fact, just again to echo David, when the COPD National Action Plan was first introduced in 2016, our co-founder, Dr. Byron Thomashow, at a huge national conference said, this disease has to live in primary care. There are a lot of people who don't have access to a pulmonologist, don't have access to those specialty services. And so it's really important that we're all working together with our colleagues in primary care to make sure that we're enabling everybody to control not just COPD, but any chronic condition you might be living with.
Thank you, Mike, for that introduction. Yeah, I want to just reemphasize this partnership. We just feel it's important that we partner as a primary care medical group, that we partner with folks that help us help our patients get access to pertinent information and communication around their chronic diseases so that they can be well and stay well, right? Right, Mike? I mean, for us, it's pretty simple. And I love that you said that, COPD is really a primary care diagnosis because and Clyde knows this all too well. If we can catch it early and monitor it frequently and get folks on the right medicines to stabilize the condition, people can live long, healthy lives with chronic obstructive pulmonary disease. And so I get it, that it feels like we're going to talk about COPD today. This is really about Medicare and our annual enrollment period, but we know that there's many folks out there in the Medicare population that suffer from chronic disease conditions. And Mike's going to share with us a little bit about how often we see that COPD, how often COPD does crop up on a patient's medical list. So, I mean, this partnership for us is really aimed to raise awareness through education and outreach campaigns to patients and help us identify those patients that are undiagnosed. And in the primary care setting, Mike can speak to this, having been there. Like, we have pulmonary function tests. We have radiology that help us diagnose this condition early so that we can get folks on the right medical therapy. Clyde, did I miss anything there, or did I cover it pretty well there?
I think you covered it very well.
Appreciate it. Mike, how about you? Am I good there?
I think so. All
right.
Awesome.
Good deal. So again, want to just emphasize the purpose of this call is to help folks become familiar with this time of year, October 15th through December 7th, as we talk about Medicare Annual Enrollment Period. Again, it's a time of year when folks get to reevaluate their Medicare coverage. Specifically today, we'll share some examples of Medicare coverage and discuss the impact for our viewers with chronic conditions. And again, by chronic conditions, we mean a disease that requires ongoing medical treatment and may impact you day to day. Mike, talk to us a little bit about why it is so important for us to discuss AEP in the context of not just COPD, but other chronic conditions that we see with the Medicare population.
Yeah, absolutely. Happy to. It turns out that roughly 60% or 6 in 10 of US adults have some kind of chronic condition, COPD, diabetes, arthritis, all of these things are fall under that umbrella. And 4 out of each of those folks also has to manage multiple chronic diseases. We see that all the time in COPD, where you're managing your COPD and you're also managing, again, your diabetes or what have you. And it's challenging. And when you have one challenge and then you multiply it by another challenge and sometimes even by a third challenge, that gets really complicated. And particularly as Medicare has evolved from its origins back in the day, Medicare has also gotten more complex. And so it's really important to have opportunities to kind of take stock of where you are physically and medically, think about where you might be over the next 12 months, and then adjust your plan accordingly so that you have the optimal coverage that's going to fit your needs.
Yeah, I appreciate that, Mike. So you'll see a poll pop up on your screen. Here we go. That's going to ask more about your understanding of AEP. Tell us how you're feeling, because we want this webinar to provide helpful information for folks at all stages in their Medicare journey. Clyde, and as you answer that, Clyde and I are going to I mean,
Yeah.
did you find that to be the same way, Clyde, with you, that it was kind of, I just thought that wasn't my job.
Absolutely. You know, patients would come and actually realizing, understanding that we're a trusted voice, and really understanding the impact of the patient in terms of whether or not I was on their panel or not, what hospital they chose, all of that really impacted. So I needed to be knowledgeable so that I could actually advise my patient in a meaningful way. So it really was incumbent upon me to learn as much about Medicare as I could.
Yeah, you see these results here, Clyde.
Yeah.
Walk us through here a little bit, but wow. Yeah.
Yeah, 35% first AEP.
First timers. All right.
Yeah, outstanding. Yeah, and 25%, you know, they've gone through AEP in the past, but find it difficult to understand. So, you know, we really appreciate you, you know, tuning in because yes, it's a lot of acronyms at certain points, and understanding insurance, health insurance is not the easiest thing. So hopefully at the end of this webinar, we will have helped you tremendously in really understanding AEP and understanding the options that you have. So
Yeah.
thanks everyone for participating in the poll. So
I'd love to share a quick story myself,
sure.
if I may.
Go ahead, Mike.
When I was in the primary care office, we were pretty fortunate. You know, we had a multidisciplinary team where we had social workers and things like that. But a big part of my job was figuring out what our folks who with respiratory problems needed for, in Medicare. And I found it to be incredibly complex. And I was tagging in people all the time. And even to this day, I still say to people, it's like, this is a big part of my world, and I still get confused by it. And I know there are a lot of people who don't have the luxury of being able to tag in somebody. So that's why, it's really important to have these kinds of opportunities and to at least know what tools are available to you so that you do have a partner of some kind to get you through it, because it is truly a maze sometimes.
Mike, you're right on point. You know, just a personal note and helping with my parents navigate, their Medicare and insurance issues. This is tough stuff. I'm a physician. I work in the business, and it vexed me in some instances. So don't think that it's just you. This is tough stuff, and we're really, really happy to be here to provide you with this webinar to help walk you through this process. So thanks everyone, we appreciate it. So throughout this webinar, we'll ask questions to make sure the information we share is most useful to you. All right, so first things first. Before starting this process, we want to make sure you're eligible for Medicare. That's the most important thing. Now, Medicare is a health insurance program for people age 65 or older, or younger people with certain medical conditions or disabilities that qualify under government rules. So now, unless you have a qualifying condition, you're first eligible to apply for Medicare 3 months before you turn 65, and you can apply up to 3 months after. Now, if you're still working and you have health insurance through your employer, you can continue that coverage instead of switching to Medicare. You may qualify for Medicare earlier if you have a disability, such as end-stage renal disease or ALS.
Well, thanks, Clyde. Like, I know that's a mouthful and that's a lot there. So folks, just know that we're going to have all this information available for you. This program is going to be recorded. You can go back and listen to it. So know that I know we're feeding you a lot of information. And please, I forgot to mention on the onset, and I see that folks are using the Q&A. Please use the Q&A. We will get to those questions, I promise. Let's learn about our plan options, our Medicare plan options a little bit. Again, look, it took me years to get this down, so please don't feel like you have to memorize this the first time you hear it, but it's just kind of an overview, if you will. Medicare is made up of parts, with each part providing a specific health coverage. Part A and Part B make up original Medicare and are federally provided programs. So remember, the hospital insurance is the Part A. It covers inpatient care in hospitals and certain skilled nursing facilities. So Part A, think hospital. Also known as doctor and outpatient insurance, Part B covers your primary care doctor, specialist, outpatient care. Sometimes we refer to a lot of the, like you think oxygen, you think wheelchairs, it's durable medical equipment, and many preventative services such as screenings, shots, vaccines, and annual wellness visits. So all that falls under Part B. Again, part of the federally provided program. Now, get to the interesting part, and I've seen a lot of questions pop up in the Q&A. Part C, and don't ask me how they came up with the letter C. Maybe it was just the next one to correlate to Medicare Advantage, but it's also known as Medicare Advantage. It's a plan through a private company that bundles the Part A and Part B, hospital and outpatient, and usually D, which is, think pharmacy, D, drugs, pharmacy. So also known as Medicare Advantage plans, Part C is a Medicare-approved plan from a private company that bundles Part A, B, and usually the Part D piece. These plans may also offer extra benefits not offered by original Medicare. So a lot of you might be familiar with these plans, that they offer vision, hearing, and dental services, which folks oftentimes need. Again, as I said, Part D is your prescription drug coverage plan. It is available to everyone with Medicare. To get prescription drug coverage, you must join an approved Medicare plan that offers prescription drug coverage. While optional, you must enroll by a certain deadline to avoid penalty costs added to your original Medicare premium.
All right. Let's go ahead and review this again. Dr. Hatfield said a mouthful. You may also hear these plans compared as original Medicare and Medicare Advantage. I know all of you have seen the commercials that run continuously on television. It's Joe Namath, it's everyone. They're specifically talking about the Medicare Advantage plans. So let's review these again. Original Medicare is a health insurance program for people aged 65 or older, or younger people with certain medical conditions or disabilities that qualify under government rules. So original Medicare includes Part A and Part B. You can also choose a separate Medicare drug plan to get drug coverage. That's Part D. So original Medicare is Part A, Part B, and Part D. So that covers hospital, outpatient, doctor's office, and equipment, and your drugs. In general, original Medicare pays for 80% of covered health costs, and you pay the remaining 20%. That's your co-insurance. Original Medicare does not cover most prescription drug costs or your vision, dental, hearing, or other long-term health needs. Now, you have everyone's heard of Medigap. That's one of the big pieces that is confusing for a lot of my patients, or the Medicare supplement. It's extra insurance you can buy from a private company that helps pay your share of your original Medicare cost, and it carries a monthly premium. So you saw above, we said that original Medicare covers 80% of healthcare costs, and you pay the remaining 20%. That Medigap or Medicare supplement plan helps you to cover the remaining 20%. So the supplement helps you cover your copay, any copays available that are out there you may owe, co-insurance that you may owe, and also deductible costs. While some Medigap plans or supplement plans may include dental, vision, and hearing, prescription drug coverage that is Part D is not included. That's a separate plan that you need to enroll in, as David said earlier. So let's talk about Medicare Advantage plans. Those are also called Part C plans. These are Medicare-approved plans from private companies offering an alternative to original Medicare for your health and drug companies. So the thing with these plans include Part A, Part B, and Part D. I often tell my patients they act like your employer insurance coverage. It's one card, all of the coverages rolled up into one. Medicare Advantage plans work to limit your out-of-pocket costs while providing access to other essential health and wellness benefits. If you choose to enroll in a Medicare Advantage plan, you still need to enroll in Original Medicare before you're enrolled into a Medicare Advantage plan. So again, I'm going to say this again. You still need to enroll in Original Medicare. Once you do that, then you're eligible to enroll in a Medicare Advantage.
Thank you, Clyde, for that summary. Appreciate it and the detail. You know, we're seeing a lot of in the Q&A folks asking, you know, what's the best plan? You know, how do I go about finding the best plan? And we're going to review a little bit about that, about how to arrive to that. You know, there are several steps you can take to put you on the path to find the best plan for your needs, because it's very personalized. One plan, it's not just cookie cutter. Just one plan is the best for everybody. It depends on your specific needs, and that's why we have, you know, these educational seminars. We have lots of information that we're going to provide you, lots of AEP resources, and we're putting some stuff in the chat there that you can see, some resources for you. But you know what, Mike, I'm going to lean on you for a little bit to tell us more about what our audience should be thinking about as we head into this all-important October, this time period. It's already started. We're already a day late, but this all-important annual enrollment period that's already started on October 15th.
Yeah, absolutely. First, I would highly recommend, whether you're watching this live or on a recording, take a second, grab some pen, grab a pencil, a pen, whatever you need, and some paper. This is a great time to take some notes, because this is really where you can work with your provider and their office to identify what's going to work best for your needs. So first of all, we need to make sure that your plan that you're looking for is available in your area. Not all Medicare Advantage plans are available across the country, like Original Medicare. Some of them are regional, some of them are by state, some are by county, some, you know, they have different kind of criteria like that. So first, you want to make sure you know exactly what you're dealing with where you live. Secondly, it's important to understand that, you know, managing chronic conditions, again, like COPD or whatever it is, the right health plan may give you some extra tools to help with that, because it can be, again, very challenging. And certain of those Medicare Advantage plans, because they can go a little bit above and beyond what Original Medicare can, help provide that. They can provide things like improved coordination of care between specialists or specialists and your primary care provider. They may be able to help you out with things like gym membership, so that you can you can stay active, you know, no matter the weather outside. And they may even be able to help you make medication costs, which, you know, are always a concern, a little bit more affordable. So a lot of them are really designed to work with you and your trusted PCP. Hopefully you have a lot of trust in your PCP, so that you can keep a good handle on your overall health and wellness. So once you kind of get an idea of that kind of overview, you need to ask yourself a couple of questions. And you can see those on the screen right now. What are my healthcare needs right now, for starters? It's always hard to look into the crystal ball and see where things are going to be 12 months from now. But again, people living with chronic conditions can often say, well, you know, it's gotten a little worse over the last couple of months. I think it's probably going to continue to get a little bit worse over the next couple of months. Maybe it's time to step up my coverage a little bit, or maybe I need to start looking at what are some of the next level things. You know, again, as a respiratory therapist, I look at things like oxygen therapy. Might I need to go on oxygen therapy in the next year? Might I need a CPAP machine to help manage my sleep apnea, or, you know, those kinds of devices? Those are really important to consider. Another consideration is, can I stay with my current primary care provider? Some of these Medicare Advantage plans have a network, you know, just like commercial insurance might, where you have a difference between an in-network provider and an out-of-network provider. And if it's really important to you, because you've built up that trust over time, if it's really important to you to keep that relationship, you may have to adjust the plan that you're looking at, so that you can stay with that trusted healthcare team. Does this plan and the providers involved with it create a personalized health and wellness plan tailored to your specific needs? We talk a lot these days in healthcare about personalized medicine and precision medicine, because ideally, I think we said at the top of the program, there really isn't a one size fits all solution. It's one size fits best for you. And so what does that look like? And is your healthcare team equipped to help you create all of that? And then, of course, again, with managing chronic conditions, prescription meds are a huge part of that. So what are those needs? Are they all generic things that you don't mind paying out of pocket for? Or do you need some of that assistance with copays and keeping medication costs down? Because then you might, that might guide your decision between, an A and B plan with Part D or Medicare Advantage. Those are all things that are going to factor into all of that. So again, it's not only complicated, it takes a little bit of planning to make sure that you're putting yourself in the best possible position for the next 12 months.
Yeah, Mike, appreciate that. I'm hearing a theme here that it's really specific to you as a patient and what your needs are, and coordinating that and finding the right primary care provider and the care team that supports you on this Medicare journey, right? Like I love that you outlined, can I stay with my current primary care provider? Like that's a big thing for folks. Many folks have had their primary care provider for years. And so, Dr. Watkins, I know this is your case out in the suburbs of Atlanta. You've had patients for years. You were meeting with patients all the time that have Medicare coverage. Why are these questions so important for them to answer so they can find the best plan for these needs?
Yeah. I mean, your healthcare needs change, they evolve, but also plans change as well. You may be in a plan that's rich in benefits this year, but also next year, the benefits may change in that particular plan. I've had patients who have chosen a plan based on cost and purely on cost, and cost is important. But when they really started to use that plan and understand the benefits that were offered, they may find that I was out of network, or there was a specific important drug that they needed was not covered, or their hospital that they use was out of network. So it really is melding, what your needs are as far as your prescription drug costs. Is your current primary care physician in the network? The hospital that's in your town, is the hospital in your town in that network? And really starting to look at your future healthcare needs. There's some plans that offer gym memberships. The importance of dental care. Do you need dental work? Do you anticipate that you will need dental work? Thinking forward, and really melding all of those considerations along with cost to make the best decision about what coverage you need.
Yeah, thank you for that, Clyde. So as we move along here, if you have questions about AEP or what Medicare plan is best for you, please go to Village Medical's helpful resources on our website to learn more about your Medicare options. Additionally, for more information on Medicare and your plan options, additional guidance can be obtained at medicare.gov, you can see on the screen there, or by calling 1-800-MEDICARE. So important resources to help you find the right plan. Speak with an independent health insurance agent, search on medicare.gov, or talk to your primary care provider. Want to remind folks that there are key differences to research between plans. We want you all to have all the information so that you can make the best choice in choosing the best option for you. So again, there are many priorities and needs to think through when picking the right plan for you. This may include your lifestyle, as Clyde mentioned, gym memberships, travel plans, personal finances, future needs. And one we want to focus on today with Mike, again, is the health conditions. And again, you can see on the screen, you are at the center of that choice and those options. It's got to fit your personal needs. And Mike, as a COPD expert, can you share more on why it is important for people with chronic conditions to pick the right to pick the right plan for their needs?
Yes, I can, because this is one of those. I mean, you want to talk about Medicare getting complicated. Boy, do I have a story for you. We've talked a lot about how Medicare only covers prescription drugs under Part D or, under an Advantage plan. But because of a quirk in the way the law was written back in the day, medications that are delivered by a device called a nebulizer, which is maybe you've seen somebody with an asthma attack or something in the emergency room, something like that. They've got the little pipe and they've got the mist coming out of it. It takes a little bit longer than the traditional handheld puffer kind of inhaler. Those nebulized medications are actually covered under Medicare Part B, because they decided, well, the equipment's covered under B and the equipment doesn't do any good unless you have something to put in it. So we're going to cover the drugs under that. So we start getting into this really complex thing about, well, what kind of inhaled medicine are you on? Because then if you have just the regular old handheld inhalers, a Part D plan might be really good for you. If you prefer or need a nebulizer, then you might need to look into Medicare or to a Part B plan. But then you get into cost again, because Medicare Part B is only going to cover about 80% of that, and some of the newer drugs that are on the market are pretty pricey. And so it's only a 20% copay, but 20% of $1,000 a month is still a pretty good chunk of change. And then you also have to consider, again, maybe I'm fine, with my nebulizer and I have a Medigap plan that's helping me cover that. But oh no, all of a sudden now my diabetes is getting worse, and my doctor wants to put me on one of those brand new GLP-1s that are $2,500 a month or whatever they are. Those are really the complexities that we have to navigate through in order to find those. So it's, what are your health conditions doing? Do you need that larger network or that nationwide network? All those lifestyle things. Where do you think your conditions are going to be in 12 months? Sometimes it really is, a crystal ball or even, tarot cards or something like that, trying to figure this stuff out. But again, working with your team, you should be able to at least get an idea to get into the ballpark.
Yeah, thank you. Thank you for that, Mike. To show the importance of picking the right plan for your needs and priorities, we wanted to share on screen what different Medicare options could look like. Between original Medicare and Medicare Advantage, y'all need to know there are unique differences. And we've seen a lot of, in the Q&A, a lot of people asking what those differences are. But just on costs alone, so think of this, for original Medicare, after you meet your deductible, you may pay 20% of the co-insurance cost. There's no yearly limit on out-of-pocket unless you have Medicare supplement that Clyde alluded to earlier, Dr. Watkins, unless you have Medicare supplement insurance or specific circumstances. For Medicare Advantage, out-of-pocket costs vary by plan for certain services. There is a yearly limit on what you pay for Part A. Remember, Part A is the hospital piece, and B, which is the outpatient or your primary care services, specialist services, specific to in and out of network services. So on premiums for original Medicare, you pay the monthly Part B premium and a separate Part D premium if participating in a Medicare drug plan. For Medicare Advantage, you pay the monthly Part B premium and your plan's premium, with some plans having a $0 premium. Most plans include Part D Medicare drug coverage. So on coverage for original Medicare, I know we're saying a lot here, but all these resources are available to you we have them all available to you. So for original Medicare, plan covers most medically necessary services and supplies. It does not cover some services, including routine physical exams, eye exams, and most dental care. And I always thought that was a little strange on original Medicare that it doesn't cover routine physical exams. But that's an important thing to note, that it doesn't cover the routine physical exams. For Medicare Advantage, plans cover medically necessary services with own coverage criteria for some services. Plans may offer additional benefits that original Medicare does not. Reviewing these plans, understanding your priorities, and walking through the questions we highlighted earlier can be helpful as you choose the right Medicare journey for you. This is just a snapshot of the considerations to think through when picking a plan. Check out Medicare.gov for a full breakdown of plan differences. Again, want to emphasize that there are key differences to research between plans. The original Medicare with a supplement, all the different Medicare Advantage plans are not the same. Just because a certain health plan, a payer has a Medicare Advantage plan, don't think that Medicare Advantage plan is equal to a Medicare Advantage plan with a different health insurance company. Remember to speak with a health insurance agent. They are the experts. These folks do more CME than Clyde and Dr. Watkins and I do in a year. Like it is insane the amount of continuing education they do to stay current with their license. Talk to your primary care provider to learn more. Most primary care docs now understand this space that they can help you navigate your healthcare needs. A great broker will ask you detailed questions about your health, prescriptions, conditions, as Mike touched on. So much of that will influence your decision on what your choice is. Anything that impedes your ability to carry out your doctor's suggested care plan, so that they can match you to the plan that works for you. So important that you get with a broker, a health insurance agent, do some research on this, but also listen to your primary care provider. You know, we have a question and answer period here, and we want to take a step back and answer some questions for you. We know we've said a lot of information's been thrown at you, so we want to take a step back and answer some questions. If you have a question you haven't asked yet, please feel free to drop it in the Q&A box at the bottom of the screen. I'm going to ask my trusted partners here, Clyde and Mike, to kind of help us answer these questions. They're kind of our resident experts, and appreciate them joining me today. But Clyde, going to start with you.
Sure.
How can I review my current Medicare plan? Pretty basic.
Yeah. So you can review your current Medicare plan by checking your annual notice of change letter. It outlines any changes to your current plan for the upcoming year. You can also use the Plan Finder tool on the Medicare website to compare your current plan with other available options. So, you know, sometimes we either by email or in snail mail, we'll get that letter of change. That's a really important letter. So, you know, don't recycle it. It outlines the changes to your current plan, so you'll be knowledgeable about how your insurance plan will change.
Yeah, I've had to help my mom with that one to not to make sure and pay attention to that one. Well, hey, Mike, not going to get you off the hook here. What is the best plan if I have a chronic condition? Hey, I teed this one up for you perfectly.
Yeah, you know, we've talked about that a little bit, a couple of different times today. It's not even necessarily that there is a best plan. It's the best plan for you. And that's really what you're going to have to look at with your health condition, with your clinical team. And you know, really that sometimes it even goes beyond that. I mean, you know, a question we get a lot with oxygen therapy is, you know, well, I get oxygen therapy covered under Part B, but you know, what's the best equipment? And it's like, well, again, that's really where you have to kind of deep dive, you know, and outside of oxygen, you know, you may have things that are covered in different ways under different plans. And so again, it's really important to just take stock, go back to those notes, figure out, you know, where you are, where you think you're going to be, and then talk to the broker, your you know, your clinical team, and figure out what those needs are going to be.
Thanks for that, Mike. Hey, Clyde, we got time for one more. How do you this is a loaded question. Clyde, how do you choose the right Medicare Advantage plan?
Well, there are many types of Medicare Advantage plans, and I'm just going to segue off of Mike. You know, the right plan is the right plan for you. So again, those questions we highlighted earlier in the webinar, thinking through your coverage needs, reviewing those available options, but also you can speak with a trusted primary care physician or a health insurance agent. These are all great ways to help you pick a Medicare Advantage plan that meets your needs. Also on Medicare.gov, you can even compare the different types of plan types for a better snapshot of differences. But really thinking forward, reading your Medicare, your change notice, understanding what having a good understanding of what your needs are, and then working with trusted advisors.
Well, thank you. Thank you, Dr. Watkins and Mike. Appreciate your expertise, your wisdom, and your input. Thank you all for those fantastic, important questions. As we wrap up our discussion today, I'm going to ask you to take out your notes one more time and write down the date, October 15th, the start of annual enrollment period. Be sure to review your coverage and make selections by December 7th, the end of the enrollment period. Now we want to wrap up. Let's hear from you all about what we discussed today. We got poll question we got this poll question up for you. How would you like to learn more about Medicare annual enrollment period?
There's also one more resource that we haven't really talked about very much. Each state has a insurance coordinator type of person, type of group, and they usually have some volunteers that can help with help guide you through that process. You can find that kind of information through your state or in the back of the Medicare guidebook. And they can connect you with again, people who are experienced in this and may be able to help you make a more appropriate decision for your health status.
Awesome. Hey, they want more additional webinars. That means either they loved the content or they loved Clyde and Mike. I don't want to ask whether they thought I did a good job or not, but it looks like additional webinars. About half of the folks want more of these webinars. So I think we're going to be doing more of these. So thank you. So want to do one more poll question for us as we wrap up. Now that we've given you all this information, we've either thoroughly confused you or hopefully you're further along. What feeling best describes how you are feeling right now when it comes to Medicare annual enrollment period? Clyde, hopefully we knocked it out of the park. Mike, I know we gave a lot of information, so I hope folks their brains aren't just swollen right now.
I feel like I'm waiting on our report card.
Yeah.
Hey, informed and hopeful. I like that. Okay.
And wanting to learn more.
Yeah, I see some optimism, and I'm not really sure. Not to worry. We're here for you to get all those questions answered, all those concerns that you have about Medicare. We want you to go to the resources that are provided. Well, it's time to wrap our time up together. I'm sure grateful again for Dr. Watkins and Mike for joining me today. Again, on behalf of Village Medical and the COPD Foundation, thanks for attending our webinar. As we continue to do some of these in the future, please share with friends and family. We would love to have the more the merrier. Your voice matters to us. Please take the post-webinar survey at the end of the event and let us know how we did. We love feedback and constructive criticism. Please help us to make these more informative and better for you all and good use of your time. Again, thanks again, and have a great rest of your day.
Thanks, everyone. We appreciate you attending.
Thank you.